Welcome back to Meds Made Easy. My name is Tarun. Today we're going to talk about Altace, probably better known as Ramipril. It's an ACE inhibitor used for hypertension, heart failure after a myocardial infarction or a heart attack. So we regulate your blood pressure because that is the underlying problem whenever you have cardiac issues like that, either for primary hypertension, or if you are in heart failure or post-heart attack, you use this medication. Very, very effective, very cheap as well, so we really like this medication. Let's go through all of the basics here. So the best way to kind of explain it without having to kind of explain the ACE pathway is it prevents an enzyme from preventing your blood vessels from constricting. So it essentially keeps your blood vessels open more. So the more open it is, the more blood can go through it and less pressure there is involved. Now, the more your blood vessels constrict, that means there's more blood trying to get through a smaller area, which causes higher pressure, right? The cardiac system is very, very easy to explain when it comes, whenever you use a metaphor of like the plumbing system, right? So whenever your drains get clogged up, you can shove all the water you want, you can create higher pressure, and sometimes you can kind of push the clog through, other times you just get backed up, right? So, but the wider your vessels are, more fluid's able to go through there, less pressure is needed. So that's what we want with your, if you have primary hypertension, is we want to alleviate that pressure in your body. Let's see here. They all come in capsules for the most part. You can open up the capsules, you can pour them in juice, water, etc. You don't really need to crush the capsules because they're not tablets, so you can open them up totally fine, not an issue. It has a black box warning for fetal toxicity, so ladies, the minute you find out you're pregnant, you do not continue taking this medication. There's been a long history of teratogenic effects that we've seen in children, so i.e. birth defects. Same goes for lactation as well. If you're lactating as well, you don't take this medication. Let's see, I'm going to put up a list of side effects. The big ones you want to watch out for are the common ones like angina, which is chest pain, like heart pain, chest pain. Hypotension, so if you feel a little bit too lightheaded, it means your blood pressure is actually a little too low. We need to raise it back up a little bit. Syncope, if you happen to feel so lightheaded that it's starting to cause you to pass out, things like that. Dizziness. Angioedema, this is an important one. So if your hands or feet start to swell up, and if you could press your thumb into it and it leaves an imprint, that means fluid's getting backed up into your body, which is not good. And this is a very, very important one for people that are either have heart failure or experiencing any stage of heart failure. You need to watch out for angioteam. That means there's signs of things getting worse and you need to immediately go see your doctor. Let's see, if you have any renal issues, generally this medication is very, very well tolerated. Only if you have severe renal impairment do you adjust the dosages. For the liver, when I looked into the manufacturing and packaging, it says it doesn't, you don't adjust the dosage if you have any liver issues, but at the same time, there are certain liver enzymes that help you digest this medication and break it apart. So then I was like, well, technically, you're taxing your liver, but the manufacturer says that you don't need to, but I'm just gonna tell you, run it past your doctor, okay? Because I saw that and I went, well, technically, it does get metabolized by your liver. If it's using any enzyme produced by your liver to break it up, right? Common sense. But talk to your doctor. Everyone's always on so many different medications. It's good to be on the same page. Make sure your doctors all know what you're taking. Beyond that, the onset of this is pretty quick. Within 1 to 2 hours, the medicine kicks in. Duration of action is 24 hours, which is why I've only really seen this medication dosed once a day, because it's a very long-acting medication. I think it may be in extreme scenarios do you see twice a day dosing, but I don't think in practice I've ever seen twice a day. It's always been one time a day. I think that's it, guys. It's a relatively easy drug. It's a really old medication, so it's cheap, it's good, it's effective, it's out there for a reason, and it's still being used heavily for that reason. If you have any questions, concerns, leave them down below. Hit subscribe, let us know how we're doing, and thanks for tuning in to Meds Made Easy. We'll see you next time. Bye.